Hello, my name is Mary Nabukenya. I'm an anesthesiologist and critical care specialist with Makerere University, and I work at National Referral Hospital. An ICU bed is not just a bed, it comes with accessories that qualify it to be an ICU bed. So you need, at the very basic, you need the bed with special functions, should be able to move up, move down. You need to have a monitor for the patient to check the patient's vitals. And then for an ICU, it would be best if it's beyond your basic monitoring, beyond just non-invasive blood pressure monitoring, beyond just pulse oximetry and pulse rate. You need at least an ECG, you need invasive blood pressure monitoring, and a few other things that come with that. And then you need a ventilator to come with that. And of course, if you have a ventilator on that, multiple power sources near the bed, you need to have suctioning, you need to have pumps, which can be used to run drugs and fluids for the patient. So that is, at the very basic, what an ICU bed is. About 2 years ago, Dr. Atumanya et al. Did a study to look at the landscape of critical care in Uganda, and they found that we had about 55 ICU beds in the entire country, and this is for a population of about 42 million people. What that means is we had about 1.3 beds per 1 million of the population. At the time, these ICU beds were found in 12 ICUs in the country. And of these ICUs, about 83% were in the capital city. So you only had about 17% ICU beds spread out throughout the rest of the country. And the public hospitals at the time that had ICUs were Mulago National Referral Hospital, Lira, Jinja, Kabale, and Bara Hospital. ICUs in this country are predominantly run by anesthesiologists and, of course, the critical care nurses. At the time, we had about 80% of anesthesiologists also within the capital city. So you had only a few of them working elsewhere in the regional referral hospitals and in the rural hospitals, looking after these patients. And then, of course, when we look at the nurses, Atumanya et al. In their study found 171 critical care nurses in total working in these ICUs. But of these, only 13 had been formally trained to work as critical care nurses. So that was a really small fraction of nurses taking care of critically ill who had the appropriate training. So what the Ministry of Health has done is doing in the regional referral hospitals is it's going to set up 10-bed ICUs in all 14 regional referral hospitals. What that means is each ICU should have some ventilators. And to date, they have acquired 109 critical care ventilators from Regional Health Systems. These ventilators will need people to run them. So the Association of Anesthesiologists of Uganda is going to embark on training of medical officers in these hospitals. We're going to train critical care nurses, or even just the nurses who will be allocated to these units to look after the patients. And then there will be need for continuous support supervision, as these are not ICUs that are just created for COVID, but we hope that they will continue to work even after COVID has been managed. The Ministry of Health has acquired a number, over 100 comprehensive care ventilators. They are low-cost ventilators, and they're really built for low-resource settings, where power supply is uncertain, where oxygen supply is uncertain. Today you have oxygen cylinders, tomorrow you don't. All this has been put into consideration. So it has multiple sources of power, it has multiple sources of oxygen. And then the other thing is the comprehensive care ventilators are quite simple and pretty easy to use after you've had some training on them. The other thing is they can be used in many situations, but you can also use them for in emergency department. You can use them during patient transport. They can be used for both adults and children. The biggest challenge that remains is human resource. Once all these 10 units, these 14 regional referral hospitals have a 10-bed ICU, they're going to need people to man them. You need nurses, you need the doctors to manage the units. So yes, the Association of Anesthesiologists of Uganda is going to train people on how to use the equipment. But then who's going to run the units? As I said earlier, majority of ICUs are predominantly run by anesthesiologists. And currently, about 77% of these people are in the city. So we don't have enough to go out there. And then two, we need nursing. There's only one critical care nursing program in the country at the moment, and that's in Bara. They can only produce so many. So there's going to be a huge shortfall for nurses that are specially trained in critical care.